You just mentioned some small topic we had on female menses. Um, Obviously, there's a bunch of factors that can go into why females would be not experiencing that. And if they quote unquote miss their period for more than 3 months, what are some of the possible things could be happening? And then why is it such a an accepted? It is quite accepted actually in an active female or a stressed active female. So why? Yeah, so a couple of points there.
So if we go way back into childhood, I start seeing already problems being created because of the aspect of eating estrogen-like precursors that are in plastics and a lot of the environmental exposure. So we have women, young girls, who are starting their menarche much earlier because they're getting higher levels of estrogen, but they're not necessarily getting adequate levels of progesterone. So they may be developing secondary characteristics, and they're already into an estrogen-dominant situation. And then when they get into an estrogen-dominant situation, they're often put on birth control pills as a 13 or 12-year-old, not for birth control, but for the aspect because they have such severe cramps and dysmenorrhea. And then that just perpetuates itself, and they stay in this high estrogen-dominant role. And then they realize at some point and said, well, I don't think taking birth control pills is necessarily a good thing, but their endocrine system has never matured properly because it's been artificially supported by external hormones or the foods that they've been eating through this that are estrogen mimics, if you like. As we see many women with menstrual irregularities, 70% of them probably are estrogen dominant. And many of the symptoms that they experience, from premenstrual symptoms, maybe from moods to food cravings to irritability or bloating, abdominal, and then a lot of cramps with their period where they may have to take some type of medications for their cramps to be able to function. So what's happened over time is that they've just sort of medicated the imbalance, and then with that specific aspect of the imbalance of the endocrine system, the body tries to compensate. And you can never treat a menstrual cycle without treating the two other critical hormones, which is the adrenal gland and the thyroid. And so I always have to treat all three of them for any woman who's coming in with any type of menstrual problem. And 60% of all menstrual problems are not menstrual, they're adrenal. Which goes back to why the importance of helping the adrenal gland is so critical, and finding out how these women are dealing with their stress. So it comes down to, what are they eating? How would factors are they determining when they're eating? And so instead of just giving them hormones or some type of even a nutraceutical, but we have to step back and say, how do we really balance your adrenal gland? Because the adrenal gland is setting the other two. And we want menstrual cycles to be between 26 and 30 days. And if they're not, then we do intervention. From a nutraceutical perspective, the essential fatty acids become an incredibly important role in the development of these specific hormones for these women. And until they get their endocrine cycle in balance, or hormones, it's going to be very, very difficult to reach any kind of high-level performance, whether they have personal training with an expert trainer or not. So it's critical that the endocrine system be in balance, but not just the estrogen and progesterone, also the adrenal gland and also the thyroid, and they always compensate. So every plan that I give a woman who has an issue involves some support for adrenal and the thyroid. So the number one always is adrenal that we go after.
Just a couple of points on, I know longevity has a piece to play in this as well, in terms of bone health and just organ health long term. But there is, I'm not sure if you're aware of it, a lot of very active, somewhat considered from the outside fit females that haven't experienced menses for a long period of time. So can you give me some ideas on repercussions possibly for those females, and what kind of things they can start with to
Well, we know that one of the unfortunate things for many women, we know from the aspects of from Olympic athletes, for example, who do very, very heavy training, that one of the worst case of osteoporosis I've ever seen was in a 28-year-old former Olympic athlete who trained 10, 12 hours a day, never had a menstrual cycle, and literally leached out her bones because she was running very high cortisol levels because of the constant stress she was under, was never able to get her cortisol levels back into normal balance. So in addition to breaking down your physical musculoskeletal system, you know that unfortunately there's a significant increase in cancer, breast cancer and uterine cancers because of the fact that the hormones, because it's meant that a woman should be menstruating, to change. And the other thing that's important about menses is, and one of the reasons that women live longer than men statistically, is because on a monthly basis, that's how they discharge a lot of their waste product, their toxicity.
Mm-hmm.
Men don't have the ability to get rid of their toxins that are building up in their system from just living in our life.
Mm-hmm.
However, women have the ability through their monthly bleed to get rid of that toxicity, which is really why they live longer by
Mm-hmm.
a few years over the course. And we see that happens that when a woman is in menopause, the diseases that men get, the women start catching up to because they lose the ability to that monthly
Mm-hmm.
ability to lose that toxicity.
Mm. So what are some initial starting points for some females that may be in that situation to begin with?
So the simplest ways that I recommend to every woman, even if she's having a normal menses, is we use nutrition, and we use nutrition from the aspect in the first half of her menstrual cycle,
Mm-hmm.
either follow, and if she's not menstruating, then we use the moon cycle
Yeah.
to regulate that.
Yeah.
But we have her eat flax seeds or chia seeds or pumpkin seeds, and in addition to that, we have her to take about 3 grams of fish oil, so EPA, DHA.
Mm-hmm.
And then when she gets to mid-cycle, when we get to a full moon, we change the seeds, we change it to sunflower and sesame seeds, and we drop down the dose of fish oils, and we add evening primrose oil.
Mm-hmm.
And we found that over the course of several months, that and sometimes using botanical medicines, we're able to start to regulate the normal flow and cycle. And in fact, it's probably the simplest, most straightforward treatment that I've recommended to many women, and probably half the women who've had irregular menses, just
Mm-hmm.
if they follow a seed cycling
Yep.
and an essential fatty acid cycling, in addition to trying to optimize the specific foods for them, they're able to get their menstrual cycle back in balance, because it's also part of getting their adrenal gland back in
Mm-hmm.
balance, which means you have to go to bed more or less at the same time, you get up more or less at the same time, you eat your meals at the same
Yeah.
time, because the adrenal gland is about routine
Yeah.
and rhythm.
Create this rhythm.
Create the rhythm.
Mhm.
And as we create the rhythm, and whether you exercise, the type of exercise at the same time, and the foods that you eat,
Mm-hmm.
is very important for balancing the entire endocrine system.
Good. I'm glad you said that, but the seed aspect is new to me. I've done the fish oil EPO variation within a month to good success because a number of clients that I'm speaking about, female clients, actually have a good quality food profile.
Right.
But again, it could always be refined in terms of the stress management when they're eating
Sure.
it, and their daily cycle. Not speaking
Right.
of the menses cycle to change that. So,
Right.
thank you for that.
All right.